Hi, I'm Kristen Marks, and I'm a Research Finance Specialist for GuideStar Clinical Trials Management. I work with GuideStar's client hospitals to process and activate clinical trials efficiently, including building and negotiating study budgets. An important component to making this happen is establishing a sound billing structure, and that requires an understanding of the nuances differentiating clinical research finances from traditional hospital billing. Research directors and research financial specialists should understand these differences and be sure to develop and follow processes to maintain compliance. In this webinar, I will discuss a few of the key differences between hospital billing and research billing. I'll touch on the differences of budgeting, entering patient encounters into an ordering system, billing, reconciliation processes, and more. Performing a Medicare coverage analysis is unique to clinical research billing and extremely important in order to prevent billing compliance issues. In order to determine what is billable to insurance, routine care, and billable to the sponsor, research-related, a Medicare coverage analysis form should be created during the study activation process. This document outlines all clinical procedures as they are detailed in the protocol. The principal investigator then makes his or her determination of what is routine care and would be provided to the patient regardless of being on trial, as well as what procedures are research-related and are specifically required for the trial. This document is also key in the post-award management phase of the study, serving as a tool for hospital billing and the registration staff to know what procedures will be billed to the third-party payers versus those billed to the clinical trials office and subsequently the trial sponsor. Another key difference between hospital and research finance is the setup of patient encounters. As previously mentioned, some of the procedures that the patient will receive may be routine care and others are purely for the research study. As such, when the subject presents at registration, two separate billing pathways must be established. If the proper process is in place and rigorously followed, registration will know which billing pathway to use per the Medicare Coverage Analysis Form. The Center for Medicare and Medicaid Services, or CMS, has specific requirements for items that must be included on bills associated with clinical research subjects. V78.7 codes, which will change with ICD-10 in late 2014, Q modifiers, and national clinical trial number requirements must be included on the claims sent to CMS for research subjects. Therefore, hospital staff who are responsible for coding research subject claims must be educated on these requirements to maintain compliance with CMS. Insurance and research reimbursements are most often tracked within two different systems: a hospital billing system for routine care reimbursements and a clinical trials management system, referred to as a CTMS, for research-related reimbursements from a sponsor. Research staff without clinical trials management software often use spreadsheets for manual tracking. Once a payment from insurance is received, it is processed as normal per hospital policy. However, when a research payment is received, the payment should be reconciled by the research department within the established tracking system to ensure that the sponsor is reimbursing the site properly for subject visits and procedures. If using a CTMS, this process also facilitates creation of a distribution memo that can be provided to hospital finance outlining how to allocate the funds. While clinical research finances differ from traditional hospital billing, understanding these differences is key to a successful and efficient research program. Having clear and detailed procedures in place is critical to streamlining the billing process, maintaining compliance, and accurately accounting for revenue. Thank you for taking time today to learn more about the nuances that separate research billing from a hospital's or physician practice's patient care billing processes. Remember, the key to billing compliance in research is to create a clear process, adhere to that process, and proper payment reconciliation. GuideStar Clinical Trials Management works with healthcare organizations around the country to support and build clinical research programs. From helping organizations incorporate a clinical trial strategy to supporting the research operation through a co-source model, our service delivery is based on operational and financial best practices to ensure optimal results for research programs.